एक बार लाइव
Yes, start please.
लगता है 1-2 मिनट रुक जाते हैं बिकॉज
मैम स्टार्ट कीजिए प्लीज.
okay. Good afternoon, everyone. This is Dr. Maria Parvez, and I'm an Ayurvedic practitioner, and I am an on-board doctor with the Indian Vaidyas and Hemp Vaidyas as well. And I'm practicing medical cannabis for a very long time now at my clinic and online as well. So today our topic would be especially on mental health. And Dr. Ananta Budhiraja, she is on behalf of the Trost brand, she's going to tell you about taking care of mental health through hemp. So today, I mean, this Monday only on 10th October, we had this World Mental Health Day. So the global, this is a very big global subject, and this time also this year, so they were focusing mainly on self-love and mental health through the global scale. So Dr. Anandita is going to present us some case studies and how hemp is helpful in maintaining the mental health and other diseases as well related to that. So Dr. Anandita, please welcome to on board, and I would like you to share your experience about hemp and its effects on mental health.
Hello, Dr. Maria, and hi, everybody. So, thank you, Dr. Maria, for inviting me here. Like Dr. Maria just said, that mental health is becoming a core issue nowadays because, particularly after this post-COVID era, mostly everybody is engrossed with some symptom or the other symptom relating to the mental health issues. So, we are focusing over here now. Mental health is defined as emotional, psychological, and social well being, where everybody needs to understand that mental health is responsible for our feelings, for our actions, how we are reacting to a particular situation, and how we are handling stress. And it is important for everybody from childhood to adulthood. And a person who is mentally healthy knows how to regulate himself, his feelings, and what are the methods to regulate by focusing upon what thoughts he's encountering, by focusing on his breath. He's aware of the self. Likewise, he's able to be optimism and being in the feelings of gratitude. He is an empath towards others, very kind and perspective talking. So by perspective talking, we understand that he is the person of others. Like, he talks in the terms of others, and he knows how to deal with people who are actually dealing with mental health. So, just like we discussed, that after the post-COVID era, we are dealing with these mental health issues. So, how is it affecting our health? It is affecting our five zones as displayed here. Our family zone, we are not able to interact with our family. We try to cut off from our social arenas. Our work zone is also affected, as in we are not able to put in more efforts. We are not able to put in more focus towards our work. And our spiritual zone and our personal zone. By spiritual zone, I mean that everybody has this every human being has this aim of fulfilling the four aspects, like we have moksha to reach. So this spiritual zone, like, it enables us to reach our final zone of being into this human life. And by personal zone, I mean that one should be able to understand themselves and encounter their own problems by themselves. So if a person is mentally healthy, they are able to figure out what's wrong with themselves, and they are able to figure out how to deal with it. So these are some words which are usually related to mental health, like our anxieties heightened. We detach ourselves from social situations. We are usually irritable, low on EQ. By EQ, I mean emotional quotient. People are not able to relate to others. Stress is there, delusion is there. People think something and react to something. Nothing is synchronized.
And there's a lack of focus also, which
So
I
yeah.
want to add. So when you're anxious or you have a generalized anxiety disorder, you have a lack of focus also, and many people complain of this problem that they are not able to focus on one thing at a time. So which I wanted to add. Yeah, please continue.
Yes. So this is the definition of WHO, like who is at the risk from developing a mental health disorder. So it explains that anybody who is going through any stressful situation at work or at home, somebody from like a near one, a dear one is ill from a long time, or losing someone, losing a job, like in the COVID, many people lost their jobs, and then they suffered from anxiety and the stress because there was the lack of jobs everywhere. So that was the main reason, I guess. Yes, Dr. Mara?
Yeah, definitely, definitely. So, post the COVID era and during the COVID era, also we have experienced a lot of patients having, midlife crisis or some financial crisis. So, definitely that is also a major factor aiding to this mental disorder, and which is a generalized thing. I mean, we don't mental health actually matters, so we don't recognize that this is something related to mental health, and we need to work upon that, or we need to cure that or get it treated by a doctor or some specialist. So I think there is a lack of awareness, and we need to be aware, especially in North India, that mental health is something. So definitely, WHO has put a lot of effort, especially this time, on mental health, because we've just gone through that phase of COVID, and we still are in that agony. I think it's still persisting. So we really need to recognize that. Yeah,
Sure. And
doctor.
nowadays, like no, like people are normalizing our habits of staying in bed, staying lazy, and staying depressed. So people are normalizing it, and I don't understand why they're normalizing it. But this is the need to understand it.
Yeah, this is the need of the hour, and definitely, because we've put up this new subject on, the importance of hemp therapy in mental health. So, as far as my experience is concerned, so definitely, hemp really helps with the anxiety disorders, and we have helped so many thousands of patients so far, only with
Yes.
hemp through this.
Yes. So like how to do the self care and how to open up. So these are some points, like how can we understand and how can we deal with our mental health. We can talk to somebody who we trust, or we could talk to a professional to seek some help. Non-judgmental strangers, like speaking in front of them is always helpful, but it actually heavy in pockets. So then there comes the drug therapy, which always has its towards effects towards the body, towards our sleep cycle and our lifestyle. It makes us dependent upon them. Then comes the herbal therapy, which is cost effective, and it does not have any side effects on the body. And as far as hemp is considered, it is considered as a whole patient treatment. So the like CBD and the endocannabinoid system, it is encircled throughout our body, whether it is our immunity, whether it's our nervous system, whether it's our digestive system or the respiratory system. So yeah, mostly like whole of the body is covered. And as we can see, the effects of hemp on our body, it's anti-epileptic. So a person who is suffering from epilepsy, a person who is suffering from brain fog or memory, he needs to enhance his memory, or dealing with anxiety, and he needs something to like enhance his already treatments that are going on. So hemp has also been proven to enhance those treatments. Dr. Maria, I'd request you to share your experiences with us.
Sure, definitely. So, I would like to introduce myself also, first of all, and I'll tell my audience about what all things we are dealing with, especially when it comes to Ayurvedic treatment and hemp-based treatment. So, definitely, as we all know, that in the post-COVID era, the mental health has been a big issue, and it really needs to get addressed because we know that. We know so many patients that they are on allopathic treatment and they're having multiple side effects out of those medicines. So especially some of the medicines that cause all these problems are antidepressants, which have very major side effects like weight gain. Some I see patients every day, they develop PCOD afterwards after gaining weight, and they have dependency on the medicine, addiction towards that medicine. They experience digestive issues and sleeping issues, and so many things, and drowsiness and all these things. They are ailing from that, and they all want an alternative to it, so that something they are taking is not addictive for them as well, and is not having such side effects of weight gain. So I think cannabis here has a very great role when it comes to weight gain, because if we talk about the endocannabinoid system, So we all have our own inbuilt endocannabinoid system. So it works on the whole body. So the cannabinoid receptors that are there in our stomach also, it is not like going to have that effect of weight gain, especially, like the side effects that a person has after taking this drug therapy, allopathic medications, antidepressants, anxiolytics, SSRIs, so many things. So this cannabinoid works very well in increasing the metabolism first of all. So cannabis works on the whole part of your body. So if we talk about mental health, I've had many patients who I've treated. So I'll talk about one of my patients. So she is from Bangalore. So because I do online consultations as well, so we do video consultations and talk to the patients. So she's from Bangalore. She's a 19-year-old girl. So recently she's been on my treatment since I think February this year, and she's still in contact with me. So because she has PCOS problems as well, she had weight gain issues. She had this teenage crisis because she was entering her college from her school. So she was anxious about her appearance, and she had sleeping issues. So we tried to, introduce cannabis, and I started with CBD oil. I won't mention the brand name, but yes, in general, I started with the 1500 mg cannabis Vijaya leaf extract. I won't call it a proper CBD oil, but yes, Vijaya leaf extract, I'll call it. So it was a full spectrum oil. So I started her with that. She really had very good effects on her sleep, her anxiety levels, her palpitations that she had, her anger pangs or depression issues that she used to have. She really felt better after that. Then after some time, because we were just I just had put her on a CBD oil initially because she was not adamant to start a proper Ayurvedic treatment at that time. After 1 to 2 months, we convinced her somehow, and started some more medications that are classical medications, Ayurvedic classical medications with hemp. So like Trilokia Vijayavati, I added for her treatment with CBD oil, and it really helped with her weight also, and it helped with her PCOD problems. She was having delayed periods at that time, so her cycles also got regularized. She lost some weight as well. Not I was not putting her on a proper diet or something. She was herself doing whatever she was doing earlier, and she lost some weight as well. Within a month, she lost 1 kg herself after starting the CBD oil. Yeah, another thing, like there's one, if we talk about cortisol levels in the body. So we all know about PCOD, and the cortisol levels, if they increase in our body, they store fat indirectly in our body. So that is also one reason why people are not able to lose weight instead of doing so much efforts. So of course, stress has that problem. Stress is the main causative factor for the cortisol levels to increase in your body. So cortisol levels, once the stress is gone, you're feeling calm and relaxed. So the body itself, decreases the level of production of cortisol in the blood as well. So that is one reason that my patient lost some weight without doing any efforts for her weight loss. So now till now she was on SSRI. Sorry, I forgot to mention. She was on Sera 100 mg. So later on, we thought of weaning her off from the medication also. So now she has been weaned. We have completely weaned her off. We put her on 50 mg afterwards after 2 3 months, and now because she was willing to stop it, initially she was very addictive to it. She didn't want to stop taking it. So I told her not, we'll do it slowly. And now she's off the medications from the last 2 months. She's feeling better. She's not even feeling addictive to it. And she really wants to continue with the medication. So we introduced Meda Sagar Ras also afterwards with my other treatment that was going on. So now she's doing fine, and she's doing better with the CBD oil and Ayurvedic treatment that we are going. So I think this is something that we have achieved so far, which I really feel proud of, and happy about this, that she's not on such medications which was causing so many problems to her. So this was one case study. And another case study was one of my patients. I won't take the name. She's a 32-year-old female. She's in Goa. So she has PCOD issues and anxiety, major depression issues, major sleeping issues. She had missed periods. I mean, she was having delayed periods. She didn't get her periods from last 3 4 months because she had some demise at home. So after that, because she went into that depression phase and anxiety, because we all had this post-COVID thing, like during COVID, we lost our near and dear ones. So she was really anxious and depressed at that time, and she didn't get her periods at all. So she tried so many medications, still she was not getting her periods. So we introduced CBD oil in her diet, and only through Trilokia Vijayavati and CBD oil, After 1 month, she got her periods also, and she lost a kg of weight as well. So after, she was struggling from getting periods from last 3 4 months. She got her periods, now they are regular, and we are treating her for PCOD as well. So this is the next case which I wanted to tell about. And there are several other cases. We come across so many patients who are anxious, having depression issues, work-related problems, professional problems, personal problems, and sleeping issues. Sleep is a major, problem which is caused by anxiety issues. So hemp has a very good effect on that. And if we talk about side effects, because we have our audience, everybody would be having a question about this thing, that is it addictive, or does it have side effects? So hemp does not have, if given through a doctor who's learned about it. So you have to see, because everybody is different. So we can't be sure about a particular dose that we have to give to our patients. So once you start seeing the patients, once you interact with them and know their problems, so you yourself get to know that you have to start it with this dose, and you can pair it up with some Ayurvedic treatment as well. If the person is having some acidity problems, or or some other issues, digestive issues, for example, so you can pair it up with Ayurvedic treatment, and it has immensely pleasing results. In fact, hemp acts as a catalyst as well for treatments, because earlier, for example, if we talk about only Ayurvedic treatment, we know it's a slow treatment, everybody calls that. So it takes 3 to 4 months for Ayurvedic treatment to actually start working. So CBD has that quality that it acts like a catalyst with the other treatment, and speeds up the treatment rate as well. So you should definitely incorporate, things, because anxiety is one symptom of PCOD nowadays, especially in females. So many other, problems like hypertension, all these things, they are like a vicious cycle. So they all are dependent on each other. So in every circumstance, you can give CBD oil after knowing about it, and definitely you should give it a try. So, Doctor, please, you can share your case studies, because we have limited time also.
Sure, sure. Thank you, doctor, for sharing your
So,
experiences with us. So I have had this patient of insomnia, and he came to us with the complaints of difficulty falling asleep, disturbed sleep. Like he was not having that particular continuous sleep; he was having breakage in sleep pattern. And whenever he woke up groggy and irritated. He was like shouting, "Why did you wake me up?" like that. And but there was this positive point that he was feeling fresh throughout his day, so he was able to focus in his work, but his only concern was his sleep patterns. So after his first consultation, we advised him to proceed with the earthy rollins and the woody rollins from the Trost brand, and we had the 6 drops of vijay leaf extract for sleep well, along with the dinner. I prescribed with the CBD oil not before the dinner or after the dinner, but particularly to be with the meals. And likewise, within 20 days of effect, we were able to see that his sleep pattern was synchronizing. Like he was feeling drowsy by 12ish or 1ish, 1 a.m ish, but not exactly to be into that like thing of sleeping. But after 45 days of time, we were able to analyze his sleep score. So before when he arrived with us, he complained that he was having, according to this insomnia index, so we were able to analyze, he had the score of 20, which declared that he was dealing with clinical insomnia, which was from moderate to severe stage. And after the treatment of 45 to 60 days, his score was 5, which clinically signified that he was not at all insomnia. And his treatment is still continuing. He's taking the medications as of now, because he complains that whenever there is work stress, he still feels those symptoms, but he is able to manage with them. So yes, his last consultation with us was in July, and post that he's taking them on and off from us only. So as of now, so from this case, we infer that the activity of hemp is acting upon brain in the pattern of in correcting our sleep patterns. Like it is reducing our REM cycle. So sleep cycle has NREM and REM cycles. REM focuses majorly upon our dreams, our nightmares, our overthinking. So that's the reason why somebody is not able to have a continuous sleep. And hemp is overcoming that because it is giving that person a state of deep sleep where he is able to restore himself and replenish himself. So, hemp by Dhoom Dandikas, we infer that they are working upon the pran vayu of our body, because when we are inhaling it through the nasal route, it is going through our nose and mouth to the brain and the lungs. And if we talk about the lymphatic system, the CBD gets encaptured with the lymph nodes, which further collaborate themselves with the CSF, the cerebrospinal fluid. And modern researchers have also proven that bioavailability of any of the herb enhances when it is taken through oral or through nasal routes. And next patient I have is he is a 40-year-old male, and he presented with anxiety related to sleep deprivation. So his major concern was anxiety, and sleep deprivation was an associated factor, where it was also like overthinking was there, and his work life was getting affected due to it. And also one physical symptom he informed us about, he was getting painful acne whenever there is any stressful situation. And we advised him 1 to 2 early roll-ins per day, CBD oil, Vijay leaf extract oil for stress buster, 5 drops BD. This was according to his body weight and according to his past experiences. So this is variable according to what symptom you are presenting and what's your history. And we also advised him another variant from our Trost brand. So it's the CBD oil for balance. So this one is raw, whereas the CBD oil stress buster is mixed with an essential oil, depending upon the like what all indications we are giving the patient. And both of these Vijay leaf extract oils were advised to him twice a day. After a few weeks, we were able to observe that his sleep has improved. His stress, he felt like it's manageable, like it's not affecting him at all, like it was earlier affecting his work schedules. And it's same goes for the anxiety, it's not affecting him much. He's able to focus more in the work, and his overthinking has calmed down, which indirectly has affected his sleep patterns in a positive manner. And for the acne, so after taking these, so we haven't added any of the acne medications in this treatment, but because this acne was rooting out from the stressful situations and the worry he was taking again and again, so this led to enhancement of or the treatment of the acne as well. So we infer that stress and anxiety have physical manifestations. Like in this case, we had acne, and other patients also, Dr. Maria, have seen that they come up with eczema, psoriasis, indigestion, GERD, as in the hyperacidity, constipation, diarrhea, the IBS, and altered menstrual cycle, like you shared with us. And whatever physical situations, physical problems the person is dealing with, they are getting enhanced due to stress.
Yeah. So in fact, in acne also, like you mentioned, that you didn't add any medicine. So I think hemp is also one very good medicine in treating such conditions, skin issues like eczema, psoriasis, and acne as well.
Yes.
Because generally these hemp also, hemp seed oil is the base in many CBD oils. One thing that is also very good as an anti-inflammatory thing for the skin on the surface as well. And plus CBD also has anti-inflammatory effects for the skin to heal internally also. Yeah.
Exactly. And next, we have a 34-year-old female who presented with us for the postpartum depression and fibromyalgia. So, she was suffering with fibromyalgia for 5 years now, and she was taking analgesics and muscle relaxants for the same. And recently, she delivered, like 3 months old only. She delivered a baby, after which she was under the postpartum depression, and insomnia was there, indigestion was there. So indigestion was basically rooting from the multiple medications, multiple treatments she was going through. She was taking sleep medications, she was taking antidepressants for the depression, and appetite enhancers. The symptoms she presented was the pain. For fibromyalgia, she told us that there was not like the pain was not always flared up. She was having that nagging pain every time, but it flared up whenever there was any stressful situation. Like I told, like we just discussed, no, that the existing situation, existing problem is getting enhanced or rising up. So
Yeah.
people
So that
these
is also according to Ayurveda. Also, we see that because of stressful conditions, the bath increases in the body, which causes body pains. Yeah.
yes. So
So she
postpartum
has all the
depression.
vata problems.
Yes, exactly. Yes. She was losing interest in activities which she used to like earlier. She was not able to spend time with family, especially her kids, which she was mostly depressed about because engrossed with herself in physical health problem and mental health problems and the medications she was taking. So she was sleeping most of the time through the day, and by the night, her kids were making her stay awake. So she was not getting that regular sleep. She was always on medications, and also in the feeling of guilty that she's not able to enjoy like take time with her kids.
Hmm.
And she told us that she stopped her medications a few time back only, the antidepressants, particularly because they were leading her to gain weight, like you told us recently. And her sleep schedules were getting hampered, and she was getting conscious about her body image. So she was seeing a psychiatrist as well as a psychotherapist. From the trust, we started her with 1 to 2 earthy rollins for the daytime. Earthy rollins, to be specified, so earthy rollins are the milder ones, and the other stronger counterpart is the woody rollins. Of course, there is a difference in their composition. We'll be discussing it later. And we started off with the Vijay leaf extract oil for stress buster, which was again according to her body weight and her past history. She showed us. And there's the one classical Ayurvedic medication which I added, Manasmitra Vatikam. This was only added for 20 days to act as a booster mechanism, because when we started with all of these medications, so it gave a boost towards her treatment procedure. And with time, we started off with weaning her off from her pain medications, and we were successful with that. So now she is dealing with her fibromyalgia. Like, the episode of the pain have reduced, like significantly reduced. Her sleep schedules are getting aligned, and her unwanted thoughts of guilty and displeasure, so she is able to tackle with them on her own self. So I feel like CBD or hemp has this good effect, that it is making people capable of themselves to think about what's wrong with them and to deal with themselves. Yeah, so her
Right.
irritability is getting lowered. She is starting to work out to work upon her body image, and likewise, she is like towards on the positive side. She is staying optimistic,
Hmm.
and as we
Okay, great.
discussed, it is a whole patient treatment.
Yeah, that's true. Okay, so doctor, now we can. I think we can take up some questions because there must be some questions coming up from the audience also. So if you can take up that, or yeah, so there are questions that we are seeing here on this screen also. Is that post delivery is also a situation where a woman is vulnerable and can lead to mental disorders, right? Yes, Dr. Prerna. So, Dr. Prerna, like you mentioned, it is very correct that post delivery also we can take that. But, doctor, one thing which I wanted to mention here is that hemp cannot be taken while breastfeeding. Okay, and while pregnancy also. So we would wait some time, to see if we can incorporate that. We can add hemp seed powder in that sense, or hemp seeds if we really want to help that the patient, or we can start her on some Ayurvedic treatment for the time being till she's breastfeeding. Or you have to consult the doctor first to see if she's actually doing the breastfeeding and at what time she's doing that, and if she's completely not breastfeeding at that time. So we have to see that just to confirm that we are not affecting the baby as well, because through breastfeed your baby is also getting the effects of the medicines that you are taking. So this is very true. But yes, after 6 months, I would recommend that a female can particularly start taking CBD oil as a treatment. But yes, hemp seeds she can take. She can take hemp seeds, hemp seed oil. She can take hemp seed powder. So that is also one very good thing for the plant-based nutrition. So another question is any other questions here?
No, ma'am. No, there any other question?
Okay. Okay. So Dr. Ananta, I think we can continue with what you were continuing with.
Sure. So, I was doing some researches upon what's the international response of hemp. So I traced back to 1621. So there's this research or this book which comes by the name Anatomy of Melancholy. Melancholy is the sadness or the boredom. So it mentions that antidepressants are addictive, they are deadly, and the therapies come with an expense. But hemp is the solution to proceed with it, to proceed with depression, to proceed with stress, anxiety. And as for talking about our Trost products, so we have this Dhoom Dandikas, two in two variants, the earthy Rollins and the woody Rollins. And likewise, I told you that earthy Rollins are the milder ones and the woody Rollins are the stronger ones. So this is a composition of five herbs, which is basically acting upon indigestion, GERD, IBS, and our respiratory system. To be in particular, peppermint is there, lavender is there. So these are acting upon our digestive, respiratory system as well. And as we have established that stress is interconnected with our digestive system, the gut health also. So it is acting upon indigestion, and it's yeah, of course a good source of replacing the nicotine cigarettes as well. So nicotine cigarettes, I feel like, Dr. Maria, the people are getting into smoking, the habits of smoking, because they are looking for an escape mechanism from their reality or from what they are going through,
Yeah,
instead of
that's true.
dealing with it in a healthy way.
So, doctor, can you please tell our audience about the composition of these roll-ins also, so people are clear that it does not have nicotine and how it's helpful for patients to get off anxiety.
Sure. So these are not having any of the chemical binding agents. These are not the paper which from which it is made. So it is chlorine free, and we have hemp leaves all there, which are less than 50% in earthy rollins. We have verbena, which is an anti anxiety herb. We have chamomile, which is anti-inflammatory and calming herb. Peppermint is there. Peppermint is again acting upon our respiratory system and our mental health. Lavender, we all know that it is calming our senses down. So it's working upon the nervous system. And likewise, the whole composition is made according to the concepts of Ayurveda and aromatherapy. Combining them together, we have found amazing results. Likewise, I just shared. And we have the second woody
Mhm.
rodent. We have about 60 to 70% of hemp leaf in there. We have damiana, which is a sleep inducing herb, and it is also a herb to enhance the sexual health of the person. For males, if they are suffering with ED, or the confidence is not there, or to enhance the fertility. And then we have lavender, which is again a calming herb. So a person who is looking out for therapeutic relaxation or therapeutic recreation, so I suppose they can go with these instead of going with any
Right.
other substances or nicotine or alcohol as well. So a person, whenever he is looking for recreation, he is not looking that he'd be going aggressive afterwards. Alcohol makes the person aggressive. Tobacco and nicotine have their own side effects upon the respiratory health and our mental health as well. They become addictive in nature. So this is non-addictive. This is completely based upon the concept of Ayurveda. We are just modernizing it,
Mhm.
because we are in Ayurveda. The concept of dhumpan comes by making a paste of the herbs and then recoiling them against a stick and then drying them up and then smoking the herb. And in this, we have
Mhm.
kept the herbs as they are. We have not modified them in any way.
राइट एंड इनफैक्ट हम बात कर रहे थे कैनबिस के बारे में विजया के बारे में दैट ये सेक्सुअल डिसऑर्डर्स में वर्क करती है तो बिकॉज ऑफ पार्ट एग्रीवेशन ऑलरेडी और जो स्ट्रेस इश्यूज होती हैं सो ऑफ कोर्स द सेक्सुअल एक्टिविटी ऑफ अ पर्सन आल्सो गोज डाउन इन केस
Yes.
ऑफ फीमेल्स एंड मेल्स बोथ तो ये
Hmm.
भी एक बाजीकरण द्रव्य की तरह यूज होता है इट वर्क्स एज एन एफ्रोडीसियाक आल्सो cannabis
Exactly.
so it enhances your urge as well.
Yes, and a sign also, because people who are looking for general well-being, like they don't want themselves on the preventive measures, they don't want themselves to be encountered with the
Some
stressful
disease.
situations of life. Yes, so they are just
Yeah.
detoxifying themselves on daily basis.
Yeah. So उसके लिए भी hemp use कर सकते हैं for people who want to get who have some history of some pre-existing disease in their family या फिर जिन लोगों को anti-inflammatory effects की वजह से cannabis चाहिए, so they can also incorporate that because we all have stressful issues, so we are all encountering stress at our levels. So you can
Yeah.
incorporate in small doses as well. You consult a doctor first, and the doctor will give you a prescription on this, and then you can definitely start using this hemp-based treatment.
Yeah. So for the Rollins, particularly the Dhumdantikas, it is essential that the person has to be above 18 years of age. And since this is Schedule E1 drug, it has to be the prescription has to be supplied through an Ayurvedic practitioner. So
Yeah.
that would be
And
it
you
from my
mentioned about the pregnancy thing also, जो हमने अभी बात की है कि
yes.
pregnant women cannot take it and nursing mothers मतलब जो breastfeeding कर रही हैं at least for 6 months. That's why I suggested कि 6 महीने तक नहीं लेना है,
Hmm.
नहीं देना है. अगर मदर वीन ऑफ कर चुकी है, वीनिंग स्टार्ट कर चुकी है, ब्रेस्ट फीड से अलावा टॉप फीड है या खाना स्टार्ट कर दिया है, सो उस टाइम आप अपने लिए यूज कर सकते हो आई मीन दिस CBD ऑयल और विजिया बेस्ड ऑयल.
Yes.
राइट.
Right. So anybody who wants to connect with us further on, the number is being displayed over here. You may also note it down 93-100-38066. You can drop us a WhatsApp or you can call us. So this will be it from our end. Dr. Mara?
Yeah, so from the Trost, you can connect with Dr. Anandita for the consultation, or they have a team of doctors who help you with encountering your problems and suggesting your particular medicine that is suitable for you. So I think we can conclude this. I hope there are no more questions from Indian Vedya's platform.
No, ma'am, there is no any other question right now.
Okay, so we can conclude it now. So thank you everyone for being a very good audience. In case you have any issues, you can contact us and let us know your queries about hemp and the hemp-based treatments. And if you have any queries or issues with hemp or any doubts about it, you can always connect with us, and we are there to help you out. I hope you all enjoyed the session. Thank you so much for being a good audience. Thank you so much. Have a nice day ahead.
Same to you.
Thank you, ma'am. Thank you.
Okay.